My name is Angela Verkade, and I am one of the ophthalmologists at Duke Eye Center in Winston-Salem. I actually went to medical school in order to do ophthalmology, so I knew that I wanted to be an ophthalmologist even before I was accepted into medical school. And that's because I felt like ophthalmology in particular, in comparison to other specialties, just allowed a better connection between the physician and the patient. I feel like everybody at one point in their lives has had a problem with their eyes, whether that was blurry vision or eye pain, and it's much easier, I think, in ophthalmology to be able to relate to patients and have that connection over other specialties. I take care of a wide variety of patients, and that includes patients who are having blurred vision or blurred vision with their glasses or contact lenses who are looking for another solution such as LASIK or refractive surgery. Additionally, I take care of patients who have cataracts as well as patients who have problems in their cornea, and that can include things like corneal swelling or opacities in the cornea that might necessitate corneal transplants. And lastly, I take care of patients who have dry eye disease or inflammation or infections in the front surface layers of the eye. Office visits and doctor visits can be very, very stressful and overwhelming, and it's important to include family members in order to assess every concern for the patient and address every question that they might have. Additionally, I like to get to know my patients, understanding their hobbies and their day-to-day lives in order to understand better what their conditions are and how it's affecting them at home. And lastly, I would say that I like to treat my patients as if they were my family member, and I would never suggest any treatment or surgical intervention that I wouldn't otherwise suggest to a family member of mine.